It looks like we're live, Kemal.
All right, so we are live. So today is November 20th. This is United Medical. So we wanted to open up with our masks on, just so that we can make our own contribution. So I'm going to take my mask off right now. Thank you for having your mask on, guys. And it would be the easiest way to protect ourselves and the society. Today, this is our weekly call, and today I have Tanner with me, as well as Donna Gunkel from United Medical Care Coordination, Clinical Integration. She's one of our directors. I would like them to introduce themselves, please.
Sure. Hi, everyone. My name is Tanner. I'm on the business development team here with United Medical.
Hi, good afternoon, everyone. I'm Donna Gunkel. I am the Director of Clinical Integration here at United Medical, and I am a nurse.
Well, you're a nurse, but you're our Director of Clinical.
I am a nurse by background.
By background, right? So this is our session 14. We are going to go ahead and share some of the updates that we have, hoping that these are useful for our patients and also for the society. So from our PowerPoint today, we always talk about United Medical. I'm not going to spend too much time on what United Medical is. Most of you already know what United Medical does. And so the main thing is we are focusing on quadruple aim, including physician and physician practices in the medical practice setting. We are the advocate for outpatient practices, private outpatient practices. We are not hospital owned. We have several different specialties in Delaware, as well as other states, up to 30 states. That's what United Medical does. Today, we are going to discuss the COVID numbers, the care coordination update from United Medical, and the recent updates from the digital health resources. And let's start with United States nationwide update. Unfortunately, the numbers are not looking nice. We are at almost 260,000. That's with 12.1 million confirmed cases. And from the recovered lives cases, it's about 7,248,000. The numbers in Delaware is also not, unfortunately, again, so when I say these, I feel a little bit, perhaps, not necessarily guilty, but I feel bad, like with what the numbers are and how they're increasing. These are the number of current hospitalizations. So Donna, your team does a lot with the hospital follow-ups, and we are going to talk about a little bit in the next couple slides. And the percentage of positive testing, that number, the 14-day running number, is close to 15% in the last couple of days. So these are alerting numbers, and I'm hoping that we are able to keep better track of these and then protect ourselves better. So the couple of the updates that I would like to give you from United Medical ACO, regardless of what is happening outside of our offices, we still have our own system for our follow-ups. Anytime any of our patients given any type of order, we are following up with those orders. So as soon as the COVID-19 started, we incorporated the follow-up for COVID from our central office. All of our patients are getting reminders, and we keep track of how many orders we have, how many of them are completed. In some cases, if the patient is not following up, we just bother them a couple more times. Now, from those, you may not know the level of United Medical in Delaware. We represent close to 15% of the population in terms of the patient care. That's about this year only, and only in Delaware, 384,000 patient appointments that we completed between different practices, different specialties. And just the appointments this month, we are at almost 27,000. And same time last year, we were at 25,500. Tanner prepared this for us, and we are going to keep updating these numbers and letting you know how we are helping our patient population mainly. So we have, for the specific reasons, we are sharing these with you. You are able to read many of these things in public publications, different publications that's available to everyone. We try to put it in a way that it's easier for you to kind of get a good summary and also see what United Medical does. And while we are doing this for our patients, we see benefits of doing this because our employees, we have employees in several different places, but we also have an office in Turkey, and they are also getting the updates from us, understanding what we are doing. So it also helps our employee communication as well as our provider communication. Now, I asked Donna to join us today so that she can give her updates from the care coordination. Donna, I'm going to share the screen again so then, so you're on.
Okay, thank you, Kemal. So yes, I just wanted to elaborate a little bit on what Kemal had mentioned earlier about orders and follow-ups. So here in the care coordination department, it really starts with our patients who have been in the hospital or in an ER. We have lists of all of the patients with the insurance company that they're with, and then, you know, which of our providers they're seeing. So we have a file that we send to DIN, which is the Delaware Health Information Network. And on a daily basis, we get a report back from them through the ENS system that tells us which of our patients were seen the prior day in the ER in any of the acute care facilities in Delaware, or they were admitted and or discharged. So the importance of that is we can very quickly, within one business day, reach out to those patients, and we try to schedule them for follow-up care with their primary care. And oftentimes we do it with their specialist if they're in our network as well. And the importance of that is if that patient needs any changes with regards to their medications, if they need to see a specialist, if they need any follow-up test, we're able to get our patients in with our providers very quickly. So this takes a look at this year from February to now, and you can see the number of patients that have been admitted and then discharged. So obviously pre-COVID in February and March, the numbers were high, and this does include also elective admissions to a hospital as well as those that are emergent. Then certainly in April and May, when COVID hit, patients were worried about going to the hospital unless they really needed to. And then also hospitals stopped doing elective surgeries. So then closer to the June and July timeframe, things started opening back up. Patients were then having elective surgeries. They were feeling more comfortable and going back for the care that they needed. So that's a good thing. We want to make sure that they're getting the care they need and they're not putting it off and therefore having other issues later on. So we've been running pretty consistently since July. You can see around 1,800 patient admissions and discharges. And again, this includes the ERs. And we're on, it looks like for November, we'll be right around the same mark of a little over 1,800. Then we can look at it from a weekly perspective. So this just gives us another way to evaluate, what's happening on a weekly basis and what may be driving those things. So as Kemal mentioned earlier, we look at the numbers related to COVID, for example. We're now entering the flu season. So again, we look at how those things are impacting our patients and also their admissions. So it also helps us to project out, how many of our patients will need to be seen. So in our next slide, we're going to look a little bit at order management. So as Kemal mentioned, and this is not only for COVID, this was our practice and our process prior to COVID. So any of our patients that see our PCPs and our specialists on a daily basis, they're given orders to see perhaps another specialist within our network, to see our dietitians or a cardiologist or a pulmonologist. So again, the care coordination teams, we receive a report on a daily basis from our electronic medical record, and we upload that to our database, and it allows us to manage that work. So within 2 days of a patient getting a referral or order to see another specialist within our network, we're able to outreach to them and to get them scheduled. So it just makes it easier for them. Instead of them having to remember or try to know who to contact, we're doing the outreach to them and getting them scheduled. So here you can see weekly numbers. So this is from the beginning of September to current. And you can see the number of patients that we're outreaching to on a weekly basis in order to get them scheduled for the services and the care that they need. So I just wanted to talk to you just a little bit about some of the wellness programs. We're very proud of these. I mentioned just a minute ago about scheduling patients to see our dietitians. So we do have a diabetes and nutrition education program. We have 3 dietitians on staff. One is a certified diabetes educator. Our diabetes program is accredited through the American Association of Diabetes Educators, and we've been accredited since April of 2016. We're very proud of that. Our dietitians also help support our bariatric program. We provide the nutritional services to them both pre and post-op.
And one of the things that we want to mention with the diabetes program is you are one of the drivers of the live sessions that we provide for the patients. So that's, if you can just maybe
Sure.
about that a little bit.
Sure, absolutely. So because of COVID, we had to look at other ways that we could reach our patient population. When we were able to see patients in the office, we held weekly group sessions. But since we were no longer able to do that, we looked for alternatives. So we started doing webinars back in September. We do them twice a month, every other Wednesday, the 2nd and 4th Wednesdays of every month. And the purpose of those is we have now a mechanism. We stream it live, but we also put it on our United Medical YouTube channel. We have it on our United Medical Wellness Program webpage as well. So we have this resource where our patients are able to hear from an array of providers. So we've had cardiologists talk to us about cardiac health and diabetes, an endocrinologist talking about how diabetes affects, the patient overall, the medications that a diabetic may take. We talk about healthy diets. We've had several other providers. We had a nephrologist talk to us about how diabetes can affect the kidneys. We've also had our optometrist talk to us about the importance of eye care and getting your dilated retinal eye exam done every year. We've had a podiatrist talk to us about the importance of being aware of any changes in your feet with regards to nerves and not being able to feel your feet, and sometimes injuries occur that may lead to substantial problems down the road. Just this week on Wednesday night, we had partnered with ShopRite here in Delaware, and they did a tour. So we have that available for our patients. It talks to them about how to make healthy choices when they're shopping and what are some of the best products to choose.
So at those events, I'm also participating, and I personally can tell you I do learn every time we have one of those. I guess as we are paying more attention, the opportunity for us to improve how we eat, what we eat, and the exercise that we have to do, how much exercise we have to do. A lot of misperception around the food. I think I personally am benefiting from it, although I'm presenting. So I'm glad that we are doing those events. Now, Donna, we are going to ask you to stay with us for a little bit more. So there are a couple of updates from the vaccine. As many of you know this by now, I'm hoping that you are not hearing this first time from me, from the audience standpoint. So the Pfizer vaccine now has an updated effective ratio that's at 95%. So as you guys know right now, there are a couple of the vaccinations are kind of, they're competing in a good way. We want this competition by all means. So as the numbers are extremely high, so there's no reason for us to put all of our eggs in one basket. So we have to really try this from different sources. Now, the latest update again from Pfizer seems like there's a 28 days, and then I think today they're gonna apply for the FDA license for the emergency use. They'll probably find out if they didn't already do it this morning. I think they're gonna do it today. Now, these, again, BioNTech, I guess we are going to call them BioNTech, maybe. They are also requesting the, so which one would you go, Tanner? For the second one, BioNTech.
The first or the second?
I guess we'd have to, it'll be interesting. I know, Kemal, that today is the day that they're requesting emergency authorization. So the new Pfizer news is good, and as you mentioned, the competition being healthy. It's not that we're looking for a one solution fits all kind of situation.
Yep. And then the way that this vaccine distribution is going to be happening is the essential workers, teachers, people in homeless shelters and prisons would like to get it like in that order, I guess. Prior to that, of course, the healthcare workers. Now, I just don't know if there will be any pushback, which we are going to find out, because I do see that in some other requirements that we have in the hospital settings or the office settings. So after the healthcare workers and elderlies and people with underlying conditions, then it's going to go to the essential workers with the with teachers and people who may be in the homeless shelters and people in prison. So hopefully we can figure this out. Now, Donna, I find this one also interesting. It was a couple of days ago on CNN. The antibiotic use for the infants, how that's linked to the childhood autism and the other health conditions. And this is a study from Mayo Clinic. So every time I see some of these, I think about our quality metrics from the ACO contracts, and isn't that kind of interesting that like those are not just like the check boxes and they're not just numbers. So there is a reason, and if you can talk about the one of those metrics that we have with patients, the kids with pediatrics on the antibiotic use.
With regards to antibiotics, I mean, usually that's like, children who have different respiratory or ear infections, things of that nature. it is one of those things where a lot of times, when anyone, child or adult, has, some kind of illness, everybody wants an antibiotic because they always think that's going to make them better. And in some cases, yes, it does. But then in other cases, we look at, certainly down the road, some of the other, issues that it may cause. So, we have to kind of look at that and see, does the benefit outweigh the risk there?
Yep, and this is one of those, again, metrics that we've been working on for the last several years, and it's good to see reliable studies supporting what we are doing. There was one other thing I believe I had. Let me see. Now, we are going to always push our own agenda in these meetings. So this is for our patients. We want to use this for patient education, digital health, and how we can actually make this more efficient for our patients. The only way that I see is if we can actually put different resources out there for our patients. So digital health, including this session, is one of those events that we are, one of those resources that we are adding. So as I mentioned, with the diabetes program, with the bariatric program, we have physicians coming in, different experts in healthcare coming in, talking to you. These are no commercial, there's zero commercial bias with these. It's for supporting the proper patient care. Anything that we may not be able to do enough with the telemedicine and others, we are adding these so that it's in your convenience. Whenever you are free, you can actually watch them. They don't have to be live. So we keep them in a really good way in our YouTube channels. And then one second, it just opened the telemedicine. It shouldn't. All right, so on the YouTube channels, we have really nicely categorized index playlist. So you can learn a lot about what you may be going through or someone in your family may be going through. Unless we are changing the form of the care that we are getting, it's not just from giving standpoint, but from also taking standpoint. We want our patients to take advantage of these extra resources, and these are all available for our patients. Now, one of the other thing that is really important again is this was something that I say since the beginning of the COVID, but also even before. Like, I'm one of the biggest supporters of private outpatient practices, especially in Delaware. I can probably easily say that if I didn't do what I did with United Medical, there would be less outpatient practices, private practices available. So less private practice means more hospital-owned practices. So more hospital-owned practices means more cost. And that was our initial maybe reason that we were trying to keep our doctors independent and autonomous from any other organizations. So we want them to provide what they are doing in their own setting. And that's only possible with the organization like United Medical. Now, one thing that became even more important is our approach in healthcare and the way that when there's a crisis, you may remember, if you guys maybe watch some of the other sessions, we talk about where to provide the care. And it's not the hospital to receive preventive type of cares when you really need to be in a setting where you are not with other sick patients. You are there in the safer environment and your outpatient practice, your outpatient primary care. So once you go into the hospital, you are there with so many other people. Or they may be with so many other people who are providing services. You see, Tanner, like the way that it happens with these settings, if I'm going to get the vaccination, So I'm going to go to one of the hospital-owned practice. So then usually they're in the hospital buildings, many of them, or their doctors may be seeing patients in the hospital where our primary care don't. So they are staying in their office. So the rate of them bringing anything to the patients is going to be less. So we don't want patients to go to the hospital for something that can be done in the outpatient setting. That's the key. There are reasons for us to be in the hospital, perfectly understandable. And we, of course, we know that I ran the hospitals program for more than 12 years in this state. But I also know that hospital is not an urgent care center. Hospital is not a primary care. Hospital is a place where patients who cannot be taken care in the outpatient setting, they go to the hospital. So your safest place is your medical doctor who is in his her office, and we have so many of those available, and we'll keep it as long as possible. So we are here to put our support for our practices. Now, one of the other thing that I want to make sure that our patients also understand is the service that we are providing. You may be getting a call from our office, from the central office, and let's say you are seen by CRIAS with Christiana Institute of Advanced Surgery, right? So you went to Dr. Erkan or Dr. Wen or any of the other doctors, and then you may be getting a follow-up call from Donna's team, right? So because her team with the clinical integration, they do the order follow-ups. So then, but the patient, sometimes they see, oh, United Medical calling, but I went to CRIAS. Well, this is part of this whole reason that we are doing this. So we are all united. So all of our practices, they may have their names differently, but at the end, it's one clinically integrated organization where Donna is the leader of the clinical integration, and we are all trying to do our support, to give our support as much as possible. So, and every time if we pick up 10, 15 patients understanding what we are doing, that's still enough. So we are not trying to pick up new patients necessarily. We are trying to provide the education for our existing patients. Now, of course, we are open for new patients. That would be great if we can, if we have new patients, but that's the main purpose for us is provide this for our existing patients. Now, before we close, next week, there will be 2 events, I believe. One is going to be on Tuesday. This is a webinar from CRIAS, and that's the partnership with St. Francis Hospital. We are also the program director. Dr. Gail Wynn is the program director at St. Francis Hospital. So there will be a webinar at 6 p.m. on Tuesday, and then there will be a live educational event on Wednesday at 3 p.m. And that's going to be myself, and most likely it's going to be with Dr. Erkan. We try to pick different cases, different topics, and we completed so many of them. So hopefully you are taking advantage of all these. Now, these are difficult times, and we are all going through the same difficulties. And I don't want to make this sound too sad, but I personally, like someone who has done so much every day, I don't go anywhere. So I'm not saying that just do what I'm doing, but it is difficult, and it's difficult for all of us. To a point, I haven't seen a restaurant in the last 8 months. And there is zero exaggeration. And if you find me, take a picture. So then you can prove me wrong, but you won't. I miss a lot of events. And part of it, I'm doing it because I have to do the right thing for us. So I have to lead by examples, and I want to make sure that our people, when they see me doing what I'm doing, they also follow and understand. But it is difficult. Now it's going to be even more difficult next week. Now, Donna, you we discussed the getting ready for Thanksgiving on Wednesday, last Wednesday with the diabetes program. And also we discussed this last Friday a little bit, just to prep you. It's 1 year, it's going to be different. So you really need to see it that way. If you try to look at it from a victim standpoint, well, you'll be depressed. So we don't have a lot of social workers available to help you. So we don't want you to be depressed. We want you to see what's happening, understand what's coming, and understand that we'll overcome this. So if you don't see that from the positive point, we have come up with a vaccination in almost 3-4 months time period, which used to take several years. So many people are working on it. We got better on the treatment of the COVID. We got better on hopefully close to the vaccines. And 1 year not doing Thanksgiving, most likely you were going to have a fight with one of your uncles or your cousins or someone if it was too crowded anyway. So it's not a big deal. It's just 1 year. So keep it small, keep your social distance, keep your mask on. If you are normally wearing glasses, you should wear your glasses just so that you are not touching your eyes. So I have my glasses here. So it's like once we touch one of these things, we want to make sure that we don't touch our mouth, nose, and our eyes. So then normally I don't wear my glasses all the time. So if I need to, I have to put it on all the time. So that it stops me touching my eyes. So please take care of yourself. We'll go through this and we'll be back next week with a couple other events. Donna, anything that you would like to say for the closing? And Tanner?
Just two quick things, Kemal, when you were talking about the PCPs. One thing as part of patient education, I do think it's important for patients to realize that their PCP is who knows them best. So if they're not feeling well, going to a hospital, if it's something their PCP can see them for, they know them better than somebody who's never seen them before. So they know about their histories and all of those things. And then the second thing is we want to make sure that patients know that every practice in our network has same-day appointments. So you can call and be seen the same day or maybe the next morning versus going and sitting in a crowded ER, for example, for many hours. So I just think it's important to get those couple of pieces of information out there so everyone's aware.
No, that's really important, and I can agree more. And that's a good reminder. Thank you, Donna.
Yeah, that's really cool. I just also would want to add to encourage everyone continuously to take advantage of these resources. You mentioned earlier that with like the diabetes webinars, it's something you're constantly learning with. It might not be something that you're normally going out of your way to find, but I think even if it's not something that necessarily pertains to you, we can all learn something from these events, and that these resources can be incredibly helpful. Maybe not necessarily for yourselves, but maybe someone in your friends group or your family. So just continue to keep on the lookout for what we're doing, and looking forward to the holidays. Just want to tell everyone to stay safe and take care.
Thank you, Tanner. Well, again, thank you so much for being with us. We'll be back next week with the CREAS events, and then after that, we'll have our Friday event resumed. So on Black Friday, we won't have a session unless if Dr. Erkan is up for having a session with me. We may just have a surprise session, but otherwise we'll be back 2 Fridays from now for this event. Again, thank you for being with us. Happy Thanksgiving and